Good morning, everyone. It's Sunday, November 24th. Massachusetts Secretary of Health and Human Services, Kate Walsh, is our guest this morning. Let's go on the record. She has guided the state through the Steward crisis, but the future of the hospital system is still uncertain. So what's next as Washington becomes another healthcare wild card? It's time to go on the record.
From WCVB Channel 5, the inside word from Washington to Beacon Hill. Today's newsmakers are going on the record.
Welcome to OTR, everyone. I'm Ed Harding.
I'm Charmin Sacchetti. With us at the table is Kate Walsh, the state secretary of Health and Human Services. Now, she joined Governor Maura Healey's cabinet in 2023. Before that, she was CEO of Boston Medical Center. She was also the chief operating officer of Brigham and Women's Hospital for 5 years. She holds a BA and a master's degree from Yale University. Thanks for being here, Secretary.
Thank you for having me.
Great to see you. Is it too early to say Happy Thanksgiving, or do we have to wait a couple of days?
Let's start.
Well, let's start. Happy Thanksgiving. It's great to have you with us. So let's talk about the hospitals that were once run by Steward. Were sold to new operators, as you know. We did, in the final math, lose 2 hospitals. State data released this month shows that it's become extremely expensive to run a hospital. So just basically, how healthy is the healthcare system here in Massachusetts?
Well, I think we have one of the best healthcare systems in the country, most notably because 98% of the people in our residents of our Commonwealth have access to health insurance, unfettered access to health care, which is really, I think, the most important thing that our health system does. Yes, it is expensive, and yes, it is more and more challenging to provide the range of services that people need. I think coming out of the COVID pandemic, I often think that most parts of the economy recovered, and that, other than downtown real estate, I think the healthcare industry is still finding its way through, whether there's a deferred disease debt that people are paying, or whether just the inflationary spiral that the economy is in has particularly hit healthcare. Both of those are really things that
how significantly has the Steward, I was going to use the word failure, operation, how significantly has it affected healthcare?
I would say that it was really a challenge because of the compressed geography of Eastern Mass and the fact that there were at one point 9 facilities in a very compressed geography. So they were providing a lot of care to people and a lot of jobs. So we were very focused on having the system of healthcare be better when we were done. And so we really looked at a regional approach. So in Merrimack Valley, the solution is different than it is in Boston and Brockton, and different than it is on the South Coast. And so I think the system is in better shape post-Stewart, but it was pretty painful getting there.
Yeah. Well, Congressman Stephen Lynch described the Steward Hospital sales last week as shotgun marriages, is what he said. He's concerned about the long-term success of some of those transactions. What is being done to ensure that? And do you have concerns about that?
Yeah, I would not describe it, with due respect to Congressman Lynch. I think that's more a reflection of his Irish wit. It was a shotgun marriage. The kid's about 2 years old. So, I think that it took a long time to find the right combination of acquirer. And it was, again, a regional response. Like, we hear about Lawrence General in Merrimack Valley, but Lowell General was part of that conversation. The Greater Lawrence Health Center was a big part of that conversation. Health insurers were a part of that conversation. So we put together a package of support from the state, because the people we insure through the Mass Health or Medicaid program live in that region, and we were able to support a very effective acquirer to take over that business. And I think it's less a shotgun marriage, but still hard work.
One thing we have all, I feel like, learned about is private equity's role in healthcare. It's a fierce debate right now. We've seen bills on Beacon Hill. Nothing has made it across the finish line. What do you want to see happen here? Should private equity continue to have a role in healthcare?
I might take a position that you might not expect me to take because of what we've just been through. But I think that, the word private equity, substitute private equity for Bank of America. Hospitals are capital intensive resources. They need investment dollars. I think that any blanket statement doesn't make sense, and particularly in a state like Massachusetts, where we have had this life science infrastructure that's funded by venture and private funds. And so you
think private equity does have a role in healthcare?
I think that private equity is a mechanism for people to access capital, and we have a healthcare system that has to change. It has to innovate. We have to find better ways to serve people.
You don't think it's a dirty word in hospital care?
I think that it was done really badly at Stewart, and it was not just private equity, but real estate investment trusts. There were a number of capital vehicles that were really challenging. But I think that we the legislature, I think, is right to take their time to understand the complexities. Healthcare is 20% of the GDP in this country. We have to really think very carefully about how and when we interrupt this system.
What about guardrails? Do you think there should be
Yes,
guardrails?
I think there should definitely be guardrails.
And so do you think Beacon Hill should act on some of those then?
I'm not going to comment on pending legislation. That's been drilled into me in this role, but I think that we have to watch how investors enter the healthcare market and very specifically how they exit.
Let's take it to a neighborhood, into a town, Madam Secretary. Norwood Hospital was in the process of being rebuilt when the Stewart crisis hit. Congressman Lynch pointed to pushback over the state having too many beds in the hospital system, and he also said he visited other hospitals that had people waiting in the hallways for admission. So you have too many in one area and others waiting in the hallways for admission. Is there a blind spot there, do you think?
I think that that the healthcare system, people focus very directly on hospitals. They're big, shiny buildings. They employ a lot of people. There's TV shows about hospitals. Like people, hospitals are big news. You guys cover them. I think we need to step back and look at regional health planning. And it was one of the things we were able to do, with Stewart, is to say, what does a region need? And I think the challenge with Norwood is that right now it's, from our standpoint as Health and Human Services, it's not a hospital, it's a construction site. We don't regulate construction sites. So and that site is owned by one of these real estate investment trusts. That was part of this whole Stewart debacle.
The town wants a medical facility there.
I understand that, but I think that it's not currently a medical facility, and somebody has to come in and figure out a way to provide services.
So this is a topic we could talk forever on, but let me ask you this. In 10 years, will Massachusetts have the same number of hospitals that we have right now?
Probably not.
Probably
I think
fewer.
If you look, I think there'll likely be fewer, but that's a trend that's continued that's gone on since I've started in this industry. I've been in this market now for longer than I care to admit. But we've steadily seen hospitals merge, contract. Some have expanded. I think that it's a very fluid, dynamic situation. But you never bet against biology. People get old and people get sick. And I'm very proud to be now a different part, but part of an industry that's here when people need them the most.
How do you ensure the survivability of these hospitals?
I think I think you have to make sure that they're delivering services that the community needs. One of the lessons from the Stewart challenge was we followed the patients. We looked at where patients were getting care, and that's where we directed our resources. As a state, again, we're an insurer through the Mass Health Program, so where our patients went, we were able to send our resources. Patients know when they're getting good care.
They can tell. Sure. All right, Governor Healy, this is a little bit of a change from Stewart. Governor Healy has just said in recent days she wants a 6-month limit for homeless and migrant families staying in the emergency shelter system. The state's price tag, we've done a lot of reporting on that, $1.1 billion. She calls it unsustainable. It is costly to keep people in hotels and in motels. Health services also play a role here. How impactful do you think this new policy will be?
I think it's, first of all, it's not only costly to keep people in hotels and motels, it's terrible for families. So we are working really hard to make sure that homelessness, because this is people talk about shelter, but this is really about housing. This is getting people into homes. And so we want to make sure that if you are unsheltered, it's brief, it's rare, and it's non-recurring. So we're looking to support families. And I served on the commission that came up with these recommendations. Of course it's hard, but I think the idea that we, instead of focusing on sticking people in a shelter, we're focusing on rapidly rehousing people. And and then in 30 days, we should be able to get somebody through what we're calling temporary respite centers or bridge shelters hopefully into housing, because that's what people want and that's what people need. You can't raise your family in a hotel.
When we come back, we're going to talk about RFK Jr.
Okay, I've been warned.
Our conversation with Kate Walsh continues after the break.